I personally have a zero tolerance policy when it comes to unethical and unprofessional fear-based care from providers. And I highly, highly, highly recommend that you report this provider to not only the state medical board, but ACOG as well. Hey y'all, and welcome back to another episode of the Birth Lounge podcast. I'm so excited to be hanging out with you today because this is one of my favorite episodes to do. Periodically, I will go into my DMs on social media and I will pull out some of your questions and I'll answer them right here live on the show. I call this a solo cast Q&A where you and I get to hang out and I answer your most burning questions. I'm going to try and get through as many of your questions as possible in today's episode, but if you don't hear a question that you have submitted recently, here is my advice to you. Number one, each week I put up a Q&A box in my stories, so make sure that not only you're following me on social media, but that you're checking back on my Instagram stories every week so that you can catch that Q&A. It will increase your chances of getting your questions answered. I get hundreds of questions each week, which I love, but unfortunately, I'm not able to get to all of those, obviously, because it truly is me behind that Instagram account and behind my TikTok account and answering my emails. I genuinely am the person who is responding to you. So I want you to know that it is nothing personal. It's not that I didn't see your question or that I am ignoring you. It's that I literally physically cannot answer all of the questions that come through my inbox. And the second thing is continue to message me because my inbox gets so bogged down. When you message me, your message actually gets bumped up to the top of my inbox. And if I am online at that time or shortly after, then your message will be at the top of my inbox. And I'm really good about scrolling back to see other messages that I may have missed. And so even if you asked a question a couple of weeks ago or even a couple of months ago, I will respond when I see you in my inbox. Again, I'm so sorry I can't get to everybody. I really do try, but I also can't live on social media. It's just not healthy for me or my mental health, nor is that any sort of lifestyle that I want. Okay, let's dive into the first question. Here we go. Hi, silly question. I've seen you say a few times how many weeks you are, and then you say on paper, and it's even more weeks. Can you elaborate? I'm not sure when I actually conceived, but I'm 10 weeks based on the first day of my last period. Is that what you're talking about? Yeah, kinda. So you actually would be 8 weeks pregnant, 10 on paper. So let me explain. When you get pregnant and you find out that you are pregnant, meaning you've missed your period, then you have not been pregnant for the entire month. Even though when you take a pregnancy test, we consider you quote unquote 1 month pregnant. Now on Instagram, I have a video that actually shows you, it has a visual to help you understand how this might be. So I'll do my best here to verbally explain it without the visual, but I definitely highly recommend going back to my Instagram, and the post is titled Calculating Your Due Date. So when your menstrual cycle starts, you have 2 weeks that you are not pregnant, and then you ovulate, and that is when you get pregnant. And then you have another 2 weeks until your missed period. At that point, you test positive, you are considered 1 month pregnant, and instead you have actually only been pregnant, literally physically fertilized egg pregnant, for 14 plus or minus a couple of days. So you say you're 1 month pregnant, but really your gestational age is 2 weeks behind that. However, this may not be a huge deal in the beginning or even in the middle of pregnancy, but when it may play a role is at the end of pregnancy, when you actually are being pressured to induce based on a date on the calendar. But when your baby is on paper appearing to be 40 weeks, meaning you've reached your due date, gestationally, literally how old your baby has been in your belly is actually only 38 weeks. Same thing with 42 weeks. When you appear like you are about to exit that window of 42 weeks pregnant, you actually have been literally only physically carrying that baby for about 40 weeks. So that's why I say on paper versus how many weeks I've actually been pregnant. Okay, our next message says, "Hi, HeHe. At my last appointment, my provider told me that I was not able to refuse cervical checks. She said that I can definitely ask for them to be limited, but it sounds like I definitely have to have one to be admitted. She also said that if I get the urge to push, she will want to check me to make sure I'm not going to cause injury to myself if I'm not fully dilated. I'm going to be declining practice pushes as well as coached pushing at 10 centimeters, and I would rather utilize the fetal ejection reflex to deliver my baby. How do I know that when my body is pushing my baby out that I don't need a cervical check and won't cause injury to myself, and how do I advocate for that?" First of all, I want to give you a little reminder to check the room and where does the power in the room lie. If you're going to let it lie with your provider, then she's right. She will be able to check your cervix whenever she pleases. However, if you're going to remain in control of the power of the room, then you get to decide who enters your vagina and when. This does mean, however, that when you show up to the hospital, you have to be undeniably in labor. So much so that you don't need a cervical exam in order to prove that you're in labor in order to be admitted. The reason that they often say you have to have one to be admitted is because they don't want to check you into the hospital and take up a bed that is revenue producing if you are not truly in labor. They'd rather send you home, let you get further in labor, and then have you come back when you're actually in labor. But if you go ahead and take care of this little piece before you arrive at the hospital and you show up truly in labor without a doubt, don't need to confirm this lady is in labor, then arguably you won't need a cervical check. Now, as far as you needing a cervical exam to push, this is evidence-based in the way that, yes, your provider is correct that in some very, very rare cases, you might be pushing or feeling the urge to push on a cervix that is not completely 10 centimeters dilated. However, we know in unmedicated birth, where you are able to feel everything and your body has unhindered communication between your cervix and your brain, that is rarely the case. More so, we find what's called the EPU, early pushing urge. I highly recommend you look up the early pushing urge so that you can be familiar with it. You can start to kind of go within and be intuitive about what you're feeling in your body. If you have an epidural and you're starting to feel pushy, then it would be totally up to you whether you wanted to check or not. But in unmedicated births, we know that tearing your cervix by pushing too early is actually a very, very rare complication. Regardless of whether you are medicated or unmedicated, the law does stand on your side. You have total control and final say of who penetrates your body and gets to check your cervix. So regardless of your doctor's preferences or whether she believes you can or can't say no to cervical exams, is incorrect. You absolutely do have the right to decline cervical exams, both at the time of being admitted to the hospital and at the time of pushing. I highly recommend you download my pushing freebie. It's going to talk to you a lot about the proper ways to push, how do you know if you're ready to push, and to dive even deeper, I really genuinely think that you could benefit from the Secret Sauce to Pushing course. It's going to deep dive into the mechanics of pushing. How do you engage the proper muscles? How do you ensure that you're actually ready to push? Which positions are best for pushing? And how do you reduce not only your push times, but also your risk for tearing? And don't worry, like everything I do, I've linked the data for you to see exactly the science that backs up what I'm teaching in the Secret Sauce to Pushing. I'll link both of those, both the freebie and the Secret Sauce to Pushing course, down below in the show notes for you. I just want to end on a note of reminding you that no one gets to make decisions about your body, especially your genitalia, and especially in a vulnerable state like labor, without your permission, regardless of the title they hold, regardless of the degrees they hold, and regardless of the position they hold at any healthcare institute. If you are declining cervical exams, it is against the law for your provider to force them on you. All right, our next question reads, "Hi there, I'm so grateful to have found you and your page. I had a miscarriage in January and I lost about 6 pounds, and now we are 4 weeks on paper pregnant. I've already lost the same amount of weight and I'm struggling to eat. I think it's more mental and less nausea-based, and my husband is starting to get very worried. Now I'm becoming an anxious, overthinking eater, which doesn't help me actually eating. Do you have any recommendations? I thought last week about getting on anti-anxiety meds. I was on it briefly years ago, but would rather not take medication." Okay. Number one, I am so sorry for your miscarriage. That is absolutely devastating, but I'm so happy for you that you are pregnant. Congratulations. I want to remind you that you're not just eating for you, you're eating for your baby too. Maybe that would be a helpful shift in your mindset to remind yourself that the food that you nourish yourself with is not necessarily for you. It's to keep your baby nice and strong and healthy and nourished inside of you. I also do want to let you know that there's nothing wrong with taking medication. And you seem like someone who has already utilized medications as a tool when you needed them and then were able to come off. Not that there's anything wrong with staying on medications long term, although I do hear you that it's not your preference to use medication, so I assume it's also not your preference to use them long term in your life. One of the most important things that you can do for your baby right now is nourish your body well and deeply. We really want you to be prioritizing protein, full fats, healthy meals, frequent eating, and hydration. Without those things, your baby is not going to be able to grow. And I know, because you're asking such deep questions, that you're such a good mom. I know that these things are on your mind because you love your baby so much. And one of the best ways that you can show your baby love in the first trimester is by eating well and keeping yourself nourished so that your body can grow this baby and keep them nourished. Our next question reads, "Do you go through metal detectors or opt for a pat down when flying? I'm pregnant and have a trip coming up." So, number one, I think it's really important to recognize that there are two different things at airports. You have the X-ray machines, and these are what you step into. There are generally places marked on the floor for you to put your feet, and you lift your hands above your head, and then this big, huge machine kind of circles around you. That's an X-ray machine. You do want to avoid those when you are pregnant, like you would want to avoid any other X-ray at let's say the doctors or the dentist. However, typically, if you're just a straightforward flyer and you haven't gotten chosen to go through the x-ray machine, you're more than likely going through a scanner, and those are harmless. However, I will say, if you follow me on social media, then you know that this baby has completed many flights. This past weekend, I actually completed our 42nd and 43rd flight together. Each time I fly, it's obviously 2 segments because I live in Boston, and most of the time I'm going someplace that requires a touchdown or a layover somewhere. And so we just completed our 43rd flight together, and 2 times throughout this time being pregnant, I have been randomly selected for an additional screening, which typically requires the x-ray machine. One was in the first trimester and one was in the second trimester. The first one I was not visibly showing, and I just simply let them know I'm pregnant and I would be opting for a pat down. The second time I was visibly showing, and I said the same thing. I didn't have trouble either time. They were very gracious. They were super understanding. No one was very annoyed. No one made me feel like a burden. I just simply said I'm pregnant and would rather have a pat down, as I'm not going to go through the x-ray machine. And I said it just like that. I wasn't aggressive. I wasn't confrontational. I just let them know the x-ray machine wasn't something I was comfortable with, and they gladly got someone over. They will make sure that you have a female personnel from TSA to do your pat down. They try really hard to have that second witness from TSA also be a female, but one of the times I had 2 women, and one of the times I had a female do my pat down, and we were witnessed by a male TSA. I wasn't bothered by either one. However, I will warn you, this was my first time doing a pat down. They are quite invasive. They are going to lift your breast and touch underneath there. They are going to pat you down all like around your butt and in the front of your vagina, and they're actually going to need to feel your genitals. They don't go inside your genitals, and you don't have to get undressed, but they will back the back of their hand up flat against your genitals just to make sure, and then they will swipe in between your butt cheeks, which I thought was both comical and unexpected. I didn't expect that. But either way, I was very comfortable. I felt very safe both times I did it. It is out in the open, so you're not by yourself. You are not in a room. You don't have to get undressed. You are fully clothed. And not only is there a TSA witness, but other passengers are witnessing this as well. And so I hope that you have TSA agents that make you feel as safe as I did. And that is kind of that. I don't go through the x-rays, but I am comfortable going through the traditional scanners, which do not use x-ray. They use CT scanning. Up next is a question about breech. It says, "Hi there. I wanted to seek your advice on how to decline a C-section at 39 weeks. My baby is breech, and they want to do a C-section at 39 rather than just waiting until she's ready. I asked if we could wait until I go into labor and just know that we would do a C-section then. However, they insisted on scheduling." Okay, so this tells me that your providers have an incredible amount of fear around breech birth. This could be because they are ill-equipped to handle a breech birth and don't actually possess the skills to deliver a breech baby, which is probably why they really insisted on scheduling a 39-week induction. Here's what I will tell you. You asked for advice on how to decline a C-section at 39 weeks. And as far as that goes, you simply decline it. You simply don't show up, you say no thank you, or you call to cancel it. However, do recognize the risk that you are taking on. And this is in no way a judgment. I just want to make sure that when you're making these decisions, you're aware of the risk and the benefits. I do think that there's a lot of benefits in waiting for your spontaneous labor to start so that your baby can get those benefits of the catecholamines and the hormones of the onset of labor. However, the risk that you're taking on is that you show up to the hospital and your baby is born breech, faster than they can get you set up and back for a C-section. And the danger there is that if you're birthing at a facility that does not have a provider that's trained in breech birth, then we actually do see worse outcomes for breech babies than if you were in a facility that had a provider that was trained in breech birth. You see, the term breech trial was quite a funky trial. It wasn't a very good study. It had a lot of flaws in it, but it determined that if a baby is born breech, then they often fare worse than babies that are delivered via C-section. However, we know that that is in fact not true if you are able to have a breech birth with a provider that has been trained in breech birth, which in that case, we get to avoid a major abdominal surgery for you and a C-section experience for your baby. However, a breech birth with a provider that is not trained and does not possess the skills to properly and safely deliver a breech baby does carry quite the amount of risk, mainly due to them being ill-equipped to support that type of birth, and their own fears will come up in that labor because, well, they know they're not equipped to safely deliver a breech baby. So many times we find providers who are scared of breech babies intervening too much and too often, and therefore they cause iatrogenic harm where they didn't mean to, but they just simply didn't have the skills. So at the end of the day, it's totally up to you. You absolutely have the right to decline a C-section at 39 weeks and wait for spontaneous labor to happen and then head into the hospital to have your C-section, as long as you understand the risk. One other thing I did want to mention when it comes to risk in this situation is that you may encounter providers being malicious or treating you unfairly, harshly, or just plain out poorly because you have gone against what they have said. And we have to remember, if they do carry this incredible amount of fear of breech birth, when you show up in labor, laboring a breech baby, you are going to trip their fight or flight. And they are going to retreat into survival mode, which generally does not fare well for patients. And you'll get the treatment that they just give. So just keep all of this in mind as you're making your decisions. I know that you'll make the best decision for you and your baby, and I trust you, regardless of whether your provider does or not. Up next is a question about being weighed at prenatal visits. This one reads, so I've recently decided that I don't want to have my weight monitored at my prenatal appointments. What are your thoughts? Well, I have a couple of thoughts. Number one, I respect you and I totally understand how sensitive weight, especially weight gain and body changes, can be in pregnancy. And I just want to validate you in that. It can be super hard to see the numbers on the scale continuously climb, especially if that's something that you've struggled with in the past. And it can be equally hard watching your body expand and get bigger each week, sometimes day by day. I do want to remind you that this process that you're doing is to bring life into the world. I know that that doesn't always make it easier, but to remind yourself that there's a reason behind that expansion in your body can sometimes be helpful. My second thought is that weight gain being monitored in pregnancy is really important in some regards. If we notice that you're not weighing enough, that you're not gaining enough weight according to an average curve, of course, not individual, we start to get a little worried about your baby's health and well-being. If you're not gaining enough weight in pregnancy, then we can almost guarantee that your baby is not getting enough nutrients. And this could cause some things like low fetal weight, preterm birth, or even placental deficiency, meaning that your placenta is not getting enough nutrients. On the opposite end of that spectrum, it is important to know if you're gaining too much weight too fast, because that may be an indicator of things like water retention or gestational diabetes. So weight, while it is probably not necessary to check every single time, it can be a good indicator to your health and your baby's health. So I've got 2 suggestions for you. I'll link in the show notes what are called Don't Weigh Me cards, and they're from an organization called More Love, and they actually read, "Don't weigh me unless it's really medically necessary." And then it says that if you do weigh me, please don't share that with me. The second thing is, you don't have to purchase one of those cards. You can simply just have this discussion with your healthcare provider about your history or about the sensitivity around your weight, and have you stand backwards on the scale so you never have to see the number. They can simply log it and ask them very directly, say to them, "When I step on this scale, I do not want you to share this number with me or indicate in any way about my weight gain unless you think that it is problematic." Beyond that, I think having a discussion with your provider about what's problematic and what is not would be really healthy. If you're just nearing the top end of the average weight gain for you, does that constitute concerning? For them, does it? Understanding where you both stand on that is going to be really, really helpful. In addition to that, I think defining how far they are willing to be flexible before they consider something concerning for you or your baby's health is also going to be really helpful in this situation. I want to let you know that the body changes that happen in pregnancy are hard for most people. You're certainly not alone in this. And I don't think it's silly or ridiculous for you not to want to know about your weight gain in pregnancy. However, I do caution you to decline weight checks altogether from start to finish in pregnancy, as they can be a good indicator of you and primarily your baby's health throughout this process. The next question reads, "Hi, HeHe. I wanted to get your thoughts on GBS. My doctor tested me for GBS at 6 weeks gestation, and they told me I had a small amount in my urine. But because of that, now he says that I have to have antibiotics at birth, even though I could test again at birth and be negative." Oh, golly gee. First of all, it was quite inappropriate for your provider to test you at 6 weeks gestation. ACOG recommends testing women a few weeks before labor. Typically, this is done between 36 and 37 weeks in pregnancy. However, their stance is that if you test positive anywhere in pregnancy, you should be treated as if you are positive at the time of labor. Now, I don't know that I personally agree with this, and I'm not even sure that the data would suggest that this is correct, but that is what ACOG says. I will tell you from a personal standpoint, this is why I have not once peed in a cup for my hospital-based midwifery team. Because I've been a doula for 10 years, I was privy to the knowledge that there are some really sneaky practices that can happen in the hospital, and this being one of them. And I knew that I wanted to avoid that at all costs. And so I haven't given them a urine sample. I wasn't going to give them a chance to test it for GBS without my consent or without my knowledge. In the show notes, I will link the evidence-based birth article about GBS for you, because it has a ton of data that you will probably be interested in, and it'll help empower you to make an educated decision about this. I do think that having a discussion, a very direct and strong boundary discussion with your provider about really wanting to be tested again closer to labor would be helpful for you, but at that point, he probably will consider you positive. However, that test result may inform your decision on whether or not you want to get antibiotics during labor. What I will tell you is the U.S. uses something called the universal approach, which means we screen everybody regardless of risk factors at that time of 36 to 37 weeks pregnant, And 60 countries use this approach, this universal approach of screening everybody. 25 countries use what's called a risk-based or a risk factor approach, which just simply means they will wait and see. They don't screen people during pregnancy, and then they monitor babies postpartum. When using that universal approach of screening everybody at 36 to 37 weeks pregnant, 0.2 babies out of 1,000 are going to develop what's called early onset GBS. When using the risk-based approach, which is the wait and see approach, 0.5 babies out of 1,000 are going to develop early onset GBS. One thing that we do know is that the antibiotics administered during labor do disrupt not only yours, but your baby's microbiome as well. So I definitely understand your hesitancy and that you are properly and rightfully so weighing the risk and the benefits. Check out that evidence-based birth article that's linked in the show notes, and I know that you will be able to make the right decision for you and your baby regarding this. The next question reads, what are your thoughts on membrane sweeps? Well, number one, they are an intervention. Number two, the success rate is about 50-50, meaning that for 50% of people they work and for 50% of people they don't work. They're often presented as this very benign thing, but they can come with risk, like accidentally rupturing your waters, so accidentally rupturing your membranes, risk of infection because we're going up in there and tampering with things, bleeding and cramping afterwards, and sometimes, in rare cases, but I have seen it in my time as a doula for 10 years, it can send you into prodromal labor, which is neither fun nor progressive or productive, nor was it the goal. I actually have a whole episode on membrane sweeps and the data around them, and I'll link that in the show notes. So you can go and listen to episode 268 of the Birth Lounge podcast to learn more. Our next question says, thoughts on family flying in to visit a newborn? My mother-in-law really wants to be part of this little one's arrival. Safety and precautions that you would recommend? I'm feeling overbearing and need some accountability or encouragement. So my encouragement to you is that this is your child, this is your birth, and you should set whatever boundaries make you feel good. I don't know that setting boundaries or asking people in your life to follow certain precautions or safety methods are, really constitutes making you overbearing. I think it makes you smart, and I think it makes you a really informed mom that clearly loves her baby. I think if somebody is coming into your home to see your baby in your fresh postpartum state, then they should be willing to follow whatever rules or precautions that you've asked them to follow. And if they don't, then for me, that's an indicator that maybe they don't deserve to be in your newly postpartum space. Maybe they're a person that needs to take some time before meeting your baby. I'm not sure if that was necessarily the encouragement or accountability that you were looking for, but I would be remiss if I didn't remind you of who you are. You are this baby's mother. You just spent your last 9 or 10 months growing them, and you get to put whatever rules around them that you would like in order to keep them safe. As far as safety and precautions that I recommend, that's so individual, and I think it also depends on so many individual and personal factors. Like, when is your baby going to be born? If they're being born in the summer versus the winter, sickness, like societal sickness, is probably going to play a role in that. If your mother-in-law is coming from a place that is 14 hours and 3 plane rides away, that's very different than if she were just traveling on one plane that is a 45-minute flight, just by, her exposure rate alone. I always think it's really wise to have people wash their hands before they touch your baby. I feel like that's a given. Have people take their shoes off when they enter your home. And maybe consider having her shower or change clothes if she arrives at your home in the same outfit that she just flew in. Obviously, you want to have a conversation with her about her own health, and if she feels sick in any way, then maybe she puts off her trip. I know that being part of your first grandchild's birth is super important to a lot of people. However, what I will say is it's more important that you get the time that you want during your birth. Your mother-in-law has already had her experience. She got to birth her babies and she got to do it her way. And if she didn't, then that has nothing to do with you. That's not your cross to bear. That's not your burden to repair now that it's your turn. This is your birth. You should do it your way, and hopefully she's amenable to that. And if not, I really encourage you to think about whether it's appropriate or not to welcome her into your postpartum space. All right, let's wrap this party up. And in true HeHe form, I'm going to leave you with a doozy. Our very last question asks, "Hey there, I just came across your page and I hope it's okay to message you." It's always okay to message me, you guys. "I am currently 26 weeks pregnant and I have a provider that told me she would really recommend a C-section due to trauma from my last 2 deliveries. My first delivery was a very slow progression with Pitocin administered, an epidural, and episiotomy. Then I ended up with 4th-degree tears. My second, from what I remembered, progressed fine. No Pitocin. Yes to the epidural, but the baby's heart rate dropped drastically during pushing, which ended up in an emergency C-section where I was put under. They said it was because the cord was wrapped twice around the baby's neck. It's been 9 years since my last birth, and I'm having my 3rd boy. What is a good way to address the concern about having a C-section? I'm just not sure if those 2 birth stories justify not even trying for a VBAC. She has told me if I had another birth like my first, my down there parts may never be the same." Okay, I gotta take a breather after that one because yikes. I'll be back. Whew, all right. I have gathered my thoughts and I am going to try and share them as politely and calmly as possible because, to be quite frank, your doctor seems like someone who just wants to control you. And without having known her at all, I hope that it's coming from a good place of concern, of not wanting to have you experience more birth trauma. But by the way that she's presenting things and the things that she is sharing with you that are neither true nor evidence-based leads me to believe that there's certainly some medical manipulation and coercion going on her part. So number one, the way that she tells you that you should have a C-section due to your trauma from your last deliveries feels very inappropriate and icky to me because she can't define your trauma for you. Only you get to define what your trauma was and what it means to you. And she does not have any authority in what you are okay taking on. So if you're okay having a vaginal birth this time and trying for a VBAC, then she doesn't get the authority to tell you not to do that, or that your trauma is quote unquote too much to try for a VBAC. Just highly, highly inappropriate in all senses, no matter how you slice that pie. Number two is that if this doctor was your doctor for your first birth, I would be so curious to know why you had an episiotomy and ended up with a 4th-degree tear. Something smells fishy about that one to me. because typically episiotomies are done to reduce tearing, right? That's the whole idea. If we cut this woman's vagina, then she shouldn't tear as badly. So, did this provider perform an episiotomy that wasn't necessary and you ended up with a fourth degree tear in addition to an episiotomy? Did she perform an episiotomy incorrectly and that caused you to also have a fourth degree tear? I'm not sure. I obviously wasn't there, but I would be super curious how you ended up with an episiotomy and a fourth degree tear. If she was your provider for your first birth, I highly encourage you to have this conversation with her. The third thing is, you mentioned that your baby's heart rate in your second birth dipped drastically during pushing. And of course, I don't know how drastically the drastic was, but what I will tell you is it is very normal, physiological, expected that a baby's heart rate will drop and have dips during pushing. They are being forced into a very small vaginal canal, a super tight space that's not only compressing them, but likely compressing the cord to some degree and periodically, i.e., during the actual bearing down. We do still, however, want to see your baby rebound and see their heart rate come back up in between bearing down and in between pushes. What stands out to me the most about that situation is that your provider blamed it on the cord being wrapped around your baby's neck twice when the data shares that most of the time, of course, there are rare circumstances which you very well may fall into, but most of the time, for the majority of what we call nuchal cords, which means the cord of your baby's umbilical cord is wrapped around their neck, once to twice, meaning it's wrapped once or twice around their neck, is almost always non-problematic. It's when we see 3 nuchals, so it's wrapped 3 times or more, that we start to see some complications arise. So this again just makes me raise my eyebrows. Was it really that the cord was wrapped around their neck twice? Very well could be. And how much of a heart rate dip was there? This is something, if you wanted to grab your medical records, you could take a look for yourself. And then I think my final thoughts about what your provider has shared with you is that she used incredibly aggressively fear-based, coercive, manipulative language, scaring you out of a VBAC by threatening your vaginal integrity, saying that if you had another birth like you had previously had, your vagina was never going to be the same. Not only do I think that's incredibly unprofessional, I think it's also unethical. And I think where I've landed on this situation is that your doctor doesn't trust herself. This is not a VBAC-friendly doctor. This is not a doctor that supports vaginal birth after cesarean. She would rather force you, or in this case, coerce you, scare you into another C-section because that's what she wants. That's her preference. That's what she feels most comfortable with, without having ever taken into account what you want or what your preferences are or what your risk tolerance for this upcoming birth for yourself may be. My very loving but blunt advice is to not only change providers, but I think that you should report this doctor to the medical board. Her care is unethical, unprofessional, and incredibly fear-based. She's not practicing evidence-based medicine, trauma-informed care, or patient-centered care. And in a healthcare system like we have right now in the U.S., there's absolutely no room to have leniency with providers like this. I personally have a zero tolerance policy when it comes to unethical and unprofessional, fear-based care from providers. And I highly, highly, highly recommend that you report this provider to not only the state medical board, but ACOG as well. You deserve better care. You deserve to be seen by a provider who trusts you to make decisions for yourself, who believes you when you evaluate your own risk tolerance. They're not trying to define what your trauma means for you. They let you do that, recognizing that you are a smart, resilient, and capable adult. You also deserve to have care by a truly VBAC supportive, not tolerant, but VBAC supportive provider who's going to help you achieve your VBAC because that's what you want. All right, you guys, that wraps up today's episode of our Q&A. I hope that you're walking away feeling empowered and having more tools in your toolbox and feeling like you have more access to data and evidence-based information to help you make the decisions that you need to in your pregnancy and birth. As always, I love hanging out with you guys. You know that. I love showing up for you guys. I love helping you find your voice and finding the information that will empower you to take back control of your pregnancy and your birth experience because that is what you deserve. You are strong. You can do this. And I trust you to make the best decisions for you and your baby from start to finish along this journey. All right, you guys, I'll see you next week. Be sure to follow along on social media. You can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye! Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.